Good morning, distinguished retirees of Lagos State Public Service. It is my pleasure to welcome you to webinar for retirees. Just a minute, I have some issues with my audio. I would like to recognize retired head of service, the 18th head of service of Lagos State, Mrs. Ajayi, who is already with us on this call. I want us to celebrate her. She celebrated her birthday on Monday. I know we are muted. On the chat, let's show her love. Let's wish her happy birthday. Let's pray for her. I also want to recognize all distinguished members of Hala Hubs on this call. Good morning. You are welcome once again for webinar for retirees. This morning, we are going to be looking at stroke awareness and prevention. As we will all know, uh, stroke is a leading cause of death globally. And in Nigeria today, stroke is a major public health concern. And as some of us may be aware, even in Lagos State, there is a ward now at Alausa that is dedicated to stroke. That tells us how serious stroke is currently. So this morning we have an expert in the house, Dr. Deborah Ajayi, who is going to take us through and share insights on stroke and prevention. She's going to be looking at lifestyle modification for stroke prevention and how we can treat and manage this health condition. Before we go further, I would like to read the citation of Dr. Ajayi. Deborah Ajayi Ifeoluwa is an enthusiast and dedicated medical doctor who trained at Olabisi Onabanjo University, Ogun State. She is currently working as a medical officer with Lagos State Health Sector. She is a highly motivated healthcare professional with commitment to delivering compassionate patient care. She is passionate about universal health coverage and loves giving back to her community. She loves giving back to her community. She's hardworking, meticulous, and detail-oriented with excellent organizational skills. She enjoys traveling and watching movies when she's not at work. Please welcome with me Dr. Ajayi. Please unmute Dr. Ajayi and go ahead with your presentation. Before you go on, please, I want to recognize a retired PS and a one-time honorable commissioner in the state, Mrs. Ogutuashi. You are welcome to this call, ma. Please go on, Dr. Ajayi.
Okay, ma. Good morning, ma'ams and sirs. My name is Dr. Ajayi Deborah Ifeoluwa, and I will be taking us on stroke awareness and prevention. Please, can we all hear me, sirs and ma'ams?
You are audible, please. Go on.
Okay, ma. Thank you, ma'am. So, apologies for the way the post slide is. So, I'll be discussing stroke awareness and prevention under the following outline: the introduction, epidemiology, the types, the risk factors, the pathophysiology, the clinical features, diagnosis, treatment, rehabilitation, prevention, and complication. So what is stroke? Stroke is a rapidly developing neurological deficit of vascular origin lasting more than 24 hours, resulting in the death of brain cells. So this simply means that it is a fast occurring medical condition that affects the blood vessels in the brain in more than 24 hours and leads to the death of the brain cells. So this can occur either as a result of problems with the blood supply to the brain. So it is either the blood supply is blocked or the blood vessels within the brain ruptures, which causes the brain tissues to die. So the brain, like every other part of the organs in the body, requires a constant supply of blood. And as we all know that one of the functions of blood is to carry oxygen and nutrients to parts of the body for the body to function. So if there is a disruption to the blood flow to the brain, it can cause damages to the brain cells depending on the duration. What I mean by that is this: if there is a disruption of blood flow to the brain within 3 minutes, damages have started occurring, but they can still be reversed. However, starting from 4 minutes and above, permanent damage starts occurring. And for more than 6 minutes, death of cells occur. So just like any other organ in the body, it requires a constant supply of blood for it to be able to function. So a stroke is a medical emergency and treatment must be sought as quickly as possible, as this determines the outcome. From what I said earlier, that the brain requires a constant supply, it is time conscious. So if no intervention is done immediately, it can affect the outcome. So there is something else called TIA, transient ischemic attack. This is a sudden focal deficit, such as a weak limb, aphasia. Aphasia means inability to speak, or loss of vision lasting from a few seconds to 24 hours with complete recovery. They are warning strikes for future strokes. So sometimes this TIA is often being mistaken for stroke. However, the difference is that for TIA, once the person starts experiencing all of these symptoms, there is full recovery after 24 hours. Unlike stroke, that you might not have full recovery. And even if you are going to have recovery, it can't be after 24 hours. So that is the difference between a TIA and a stroke. And once one starts having TIA, it is a warning sign that there are future strokes coming. So epidemiology: stroke is the second most frequent cause of death worldwide, accounting for 6.2 million deaths as of 2011. It is ranked after heart disease and before cancer, which means it's ranked after heart disease and before cancer. So between 1990 and 2010, stroke decreased by 10% in developed countries and increased by 10% in developing countries. And this is because developing countries don't really have the gadgets to manage stroke immediately. Even the presentation to the hospital before intervention is sought, it can be delayed due to various factors compared to developed countries where everything is organized. So overall, two-thirds of strokes occur in those over 65 years, while one-third occur in less than 65 years in patients. However, it does not mean that it cannot occur in either of the patient. It's just that it is the rate of occurrence is increasing with age. So as one ages, the risk of having stroke increases. Nearly 800 people suffer stroke each year in the US, 82 to 92% being ischemic stroke. We are still going to talk about the types of stroke that we have. So according to WHO, 15 million people suffer stroke worldwide each year. Of these, 5 million die and 5 million are left permanently disabled, which means the other 5 million, they undergo good recovery. They have good outcome. So men are 25% more likely to suffer stroke than women, yet 60% of death from stroke occurs more in women. I would explain that further. So the types of stroke that we have, stroke is broadly classified into two. We have the ischemic stroke and the hemorrhagic stroke. Another name for the ischemic stroke is infarctive. So it's infarctive stroke or ischemic stroke and hemorrhagic stroke. So ischemic stroke is the commonest, accounting for 80%, while hemorrhagic stroke accounts for 20%. So each of these strokes, they have further classifications. The ischemic stroke is further classified into thrombotic and embolic stroke. Then the hemorrhagic stroke is further classified into intracerebral, hemorrhagic, and subarachnoid hemorrhagic. So this is a pictorial representation of the types of stroke. I will still explain this during the course of the presentation. So what are the risk factors or causes of stroke? So they can be broadly divided into two. We have the non-modifiable risk factors and the modifiable factors. So non-modifiable risk factors simply means they are factors that are beyond our control. They are factors we don't have control over. They are factors that occur by nature. So examples of these factors are age. We don't have control over our age. So it is commoner in people greater than 60 years. Doesn't mean it cannot occur in people less than 60 years, just that it is commoner in people greater than 60 years. Gender is another factor. When less than 55 years, it occurs more in males than in females. But after menopause, the rate of occurrence is equal for both male and females. And the reason is because before menopause, the women, they have high quantity of estrogen. So that acts as a protective factor. But after menopause, the quantity of the estrogen reduces. In fact, the quantity of the hormones in general reduces. So there's really no protective factor again. So another non-modifiable risk factor is race. It's commoner in blacks than in the Caucasians. Then a previous history of stroke is also a non-modifiable risk factor. If stroke has happened before, it can happen again. Then there are some hereditary stroke disorders too. However, this can only be detected in developed countries. Developing countries don't have the facilities yet to detect this. So for the modifiable risk factors, this means there are things that we have control over. There are things that we can decide to change. So examples of the modifiable risk factors are uncontrolled hypertension. If one is hypertensive, you are not taking your drugs as prescribed by the doctor. You are not eating right. You are not following what the doctor says. It can lead to stroke. Poorly controlled diabetes too, high blood sugar. If the blood sugar is not controlled, it can cause stroke. High cholesterol, which is dyslipidemia, can also cause stroke. Smoking of any sort, either cigarettes, cocaine, marijuana, name it, it can cause stroke. Alcohol consumption can cause stroke. Sedentary lifestyle also can cause stroke. Then heart-related diseases, prolonged anticoagulant use or antiplatelet drug use can cause stroke. Oral contraceptive pills, pregnancy, dehydration. So I said here that stroke can also occur in young people and in children with sickle cell disease. So this is a pictorial representation of the factors I just mentioned now. So going to the pathophysiology of stroke. How does stroke occur? So I'm going to start with ischemic stroke. So in ischemic stroke, there is insufficient blood flow to supply the brain. Hence, there is reduced oxygen supply due to narrowed or blocked arteries leading to or within the brain. Narrowing is commonly as a result of atherosclerosis, often seen with increasing age and high cholesterol, which is occurrence of fatty plaques lining the blood vessels. So this atherosclerosis occurs as a result of fatty plaques lining the blood vessels. So the fatty plaques deposit inside the walls of the blood vessels, thereby narrowing it and sometimes eventually blocking the blood flow to the brain. So, and this atherosclerosis can occur as a result of increasing age and high cholesterol. So, as the plaque increases in size, that's the fatty debris that is deposited within the walls of the blood vessels. As they increase in size, the blood vessels become narrowed and then the blood flow to the brain is reduced. So sometimes these plaques that are deposited inside the walls of the blood vessels, they dislodge. They dislodge and they can cause blood clot to form. So this blood clot too can block the blood vessels. It's like if you have a wound on your skin and then you clean it and all, some you at a point you see that blood will have clotted on it as a form of as a to reduce blood flow, to reduce bleeding from the site. So that is what happens too. Sometimes the plaques can dislodge, the vessels will bleed a little bit and then clot. So that clot itself too can reduce the blood flow to the brain. So that is the pathophysiology of the thrombotic stroke. However, for the second type, which is the embolic stroke, which is still under ischemic stroke, blood clots from any other part of the body for any other reason can dislodge from that part and then travel through the bloodstream to the brain to go and block the blood vessels. So that is for ischemic stroke. So for hemorrhagic stroke, there is rupture of the blood vessels leading to compression of the brain. And these ruptures can be caused by poorly controlled hypertension, trauma, blood thinning medications, weakness in the blood vessels. So in essence, these ruptures most times they are caused by increased pressure that the blood vessels cannot withstand anymore. So when the pressure is too much, the blood vessels rupture. And then instead of going in through blood vessels to supply nutrients and oxygen to the brain, they flow out and compress the brain. So there is no blood supply to the brain, and then blood is still compressing the brain. So that is for hemorrhagic stroke. There is a pictorial representation of the types of stroke that I just mentioned. So this is the thrombotic stroke. You can see the plaque. These are the plaques, the fatty deposits on the walls. So sometimes it dislodges and then forms clots. These are the clots. This is the clot. So and then it narrows blood flow, narrows the blood vessel. So this is an example of the embolic stroke. This is the clot from other parts of the body that just for some reason travels into the blood vessels in the brain and then blocks blood flow. So this is the hemorrhagic stroke that occurs as a result of the blood vessels bursting, either as a result of increased blood pressure, the increased pressure that the blood vessels cannot handle, or maybe there is a weakness in the wall of the blood vessel. So what are the signs of stroke? It is important to know these signs because, like I said, stroke is a fast occurring medical condition. So the moment you recognize the signs, you go straight to the hospital. So some of these signs are weakness, and it is a sudden loss of strength or sudden numbness in the face, arm, or legs, even if it is temporary. Some people they might find it difficult to raise the hand or the legs up. The legs might become too heavy to lift. The arms might become too heavy to lift. You should be thinking of stroke. Another sign is trouble speaking. When there is a sudden difficulty speaking, someone that has been speaking well before and then all of a sudden just has trouble speaking, or the speech becomes slurred, you want to think stroke, or there is sudden confusion. Then vision problems. When there is sudden trouble with vision, either in one of the eyes or both eyes, even if it is temporary, you should think stroke. Then sudden, severe, and unusual headache, think stroke. Then sudden loss of balance, especially if it is with any of the signs I mentioned earlier, you should think stroke. So there is an acronym one can use to recognize the signs of stroke. The acronym is Be Fast. So B is for balance. As the person suddenly lost balance. E is for eyes. As the person suddenly lost vision in one of the eyes or both eyes. F is for face. Does the person's face look uneven? Is it like there is a deviation of the mouth or the face to one side of the body? Then arms. Is one of the arms hanging down or both, or the person is not able to lift the arms or even the legs? S is for speech. Is the person's speech slurred? Does the person have trouble speaking or even seems confused? So T is for time, which means you have to act fast. You want to call for help. If you are able to access a hospital, please quickly go to the hospital or you call for help. That's the most important thing. Call for help. This is another slide showing stroke recognition. You can tell the person to smile and try to stick the tongue out. You see the facial deviation, you see the mouth deviation to one side of the body. Then you can tell the person to make a complete sentence. If the person cannot make complete sentence, think stroke. Then you ask the person to raise the arms and the legs. If the person cannot perform any of this, you want to call for help. So other symptoms include vomiting, bladder and bowel control problems. So they might urinate on their body, they might poo on their body. Then pain in the limbs that gets worse with movements and temperature changes. So the diagnosis of stroke. How can we diagnose stroke? Like I said earlier, strokes happen fast and will often occur even before the individual can be seen by a doctor for proper diagnosis. This is not something that's treated at home. It is something that is treated in a hospital, a well-equipped hospital. So the doctor will take history and then performs his or her examination and order for tests. So there are specific tests for stroke and there are just routine tests that can be done. Specific tests are the CT scan and the MRI. Those are the brain imaging studies. And the general tests include your full blood count, blood sugar, lipid profile, which is to check for high cholesterol, UCL to check for the kidney function. You want to check the urine, you want to check the heart function through the ECG and echo, amongst other tests. So this is an example of the CT scan. It uses a series of X-rays to create a detailed image of the brain. So it can show if the person is currently, for example, now this is the site of the stroke here. It can show if the person is currently bleeding into the brain or if the stroke has already occurred and then that area of the brain is dead. So this is an example of the CT scan. Then this is an example of an MRI. So the advantage of MRI is that it can distinguish between the ischemic stroke, hemorrhagic stroke, and if there is any other thing else in the brain. For example, if there are tumors in the brain, it can distinguish them. So treatment of stroke, like I said, it is not something that is treated at home. This is a medical emergency and should be treated in a well-equipped hospital. So the treatment depends on the mode and time of presentation. Like I said earlier, most times the damage would have already been done in the brain. before the caregiver calls for help, before they get transport, before they get to the hospital, this might have already been done. So on getting to the hospital, depending on the assessment of the doctor, he or she will determine the mode of treatment. So the patient is admitted. If the oxygen saturation is less than 93, patient will be given oxygen. Patient will be given IV fluids, which is commonly known as drip. Then if the doctor is suspecting an ischemic stroke, or there is a CT scan finding and then it's showing ischemic stroke, depending on the presentation of the patient, if the patient presents within 3 hours, patient will be given a group of drugs called thrombolytics. So the blood pressure of the patient will be controlled. Patient will be given statins. Those are the cholesterol lowering agents. Then patients will be given aspirin or clopidogrel if the stroke is an ischemic stroke. So this is just what I said earlier. The aspirin, the thrombolytic agents, the statins, lipid lowering drugs, and the antihypertensives. Then you want to do blood sugar control. Then patient is given antioxidants, they help in neuronal health. You want to catheterize the patient. A patient that has stroke that cannot move obviously cannot be going to the toilet to wee or poop. So the patient is catheterized not only to help the person pass out urine, it also monitors urinary output. It monitors if the patient's kidneys are actually making adequate urine. Then the doctor will identify and treat the underlying cause. So as treatment progresses, patients will start physiotherapy. However, if after doing all of this, the stroke is still there, or one of the brain imaging is suspected that the patient is still bleeding inside the brain, surgery might have to be performed. That is for hemorrhagic stroke. Then the patient is monitored for discharge and then given outpatient treatment. So, however, while on admission or after discharge, it is important to prevent pressure sores by proper positioning, frequent turning, avoid tight-fitting clothes, use of water beds to relieve pressure points by padding and cushions. Now, this is because someone that has stroke that cannot move would most likely be in the same position every time. And when the person is in the same position every time, the part where the person is sitting on, there will be reduced blood supply to that place as a result of the pressure effect on that particular place. There will be reduced blood supply to the place, and then the person might start having sores. And so this is why it is very important to prevent pressure sores. No, the person is still nursing stroke, so you don't nurse stroke and something else. Then you want to improve the circulatory and respiratory functions. So the doctor might tell the patient to get a balloon to be blowing into. This just improves the lung functions. So rehabilitation, strokes are life-changing events that can affect a person physically, emotionally, and mentally. So recovery is not complete without rehabilitation, and this involves speech therapy. So it involves a speech therapist. It helps with problems producing and understanding speech. Then you also have physical therapy, which involves a physiotherapist. So it helps the person relearn movement and coordination, and it helps to restore strength into the limbs. Occupational therapy, this helps to improve their ability to carry out their daily activities. For example, if stroke occurs in someone that used to do maybe plumbing or something that involves the person moving up and down, and the stroke happens and there's still a deficit, the person still can't really move the limbs, the person will have to go into another line of work. So that's the essence of the occupational therapy. Then also support groups. Joining a support group helps to share common experiences and exchange information. It helps with common mental health problems such as depression, which can.
As you already know, most people on this call are elderly,
and they want to prevent the incidence of stroke. Thank you. Are you still there, doctor? I was talking to you. Did you hear what I said?
Yes, my did. So I was coming to the prevention.
Okay, all right.
Okay, so how do you prevent stroke? This is best addressed by treating the underlying cause. For example, if one has all of the risk factors that I mentioned earlier, you want to make sure you are managing those risk factors. For example, if someone is hypertensive and you were placed on drugs by the doctor, you want to make sure you are using your drugs as prescribed by the doctor. You are eating healthy. If one is diabetic, you want to control your blood sugar by using the medications that the doctor prescribed for you, by eating what the doctor told you to eat. Then if you have high cholesterol, you'll be given drugs for that also. You make sure you use your drugs as at when due, and you don't stop the drugs on your own accord. You go back to your doctor. If the doctor sees it fit to reduce the dose or to stop the medications for you, or for you to continue the medications, your doctor will communicate that to you. So apart from the pharmacological part, which is the use of drugs, you also want to do lifestyle modification. So this involves eating healthy diets. You want to maintain a healthy weight. You want to exercise regularly. You want to avoid smoking, avoid alcohol intake. You want to avoid herbal concoction intake. As for the diet, there are some foods I'll be mentioning that one can eat that is seen as healthy. However, a nutritionist will be able to tell you more on the foods that you can eat. So for the foods that you can eat oats, you can eat almonds, soy, strawberry, low fat milk rather, not the full cream milk. Then you can eat blackberries, banana, barley, cornmeal, salmon. Then you can also do white meat. You want to avoid red meat also. Then you want to avoid excessive intake of salt and Maggi. You want to reduce your oil intake. You want to eat more of fruits and vegetables. One key thing in eating healthy is portion control. You cannot eat the portion you were eating when you were 20-year-old, 30-year-old, even 40-year-old. You can't eat that same portion now. If you have a plate, half of your plate should be more of fruits and vegetables. Then the other half, the other quarter carbohydrates, then your proteins and fat and oil. So this is another pictorial representation of how you can prevent stroke. Prevention of stroke does not only have to do with you using your drugs, it has to come in place with also lifestyle modifications. So here are some complications of stroke. We have some neurological complications. There are some also systemic complications and also some chronic complications. So some systemic complications, there could be sepsis, which is infection of the body. There could be aspirations in the chest that can lead to recurrent chest infections. There could be bronchopneumonia. There could be urinary tract infections. Then some of the long-term complications are dementia, gait abnormalities, as a residual effect from the symptoms of the stroke. There could be speech difficulties, there could be contractures, there could be epilepsy. So in conclusion, stroke is a rapidly occurring medical condition and treatment must be sought immediately. You must be able to recognize the signs and symptoms using the BFAST method that I said earlier on. You want to prevent stroke by using of your drugs if you have a medical condition, managing your medical condition well. You want to eat healthy diet, you want to maintain healthy weight, you want to get enough exercise, you want to limit alcohol use, limit smoking, You want to, as well as if you are using your drugs for the medical condition, you also want to monitor those parameters. You cannot be using blood to control blood pressure and then you are not monitoring your blood pressure. You cannot be using drugs to control your blood sugar and you are not monitoring your blood sugar. So they come hand in hand. So you want to manage the medical condition well. Then you want to talk to your medical doctor and don't do self medication. So that will be all. Thank you so much for having me. Thank you.
For a well presented paper, I just want to do a little review before I open the floor for questions and answers. So the first thing I want us to note is the fact that stroke is a medical emergency. And then she mentioned an acronym that can help us to identify stroke. Be fast. Be fast. B stands for balance. The E is for eye. When the vision is blurry, and then F is for face. When the face is uneven. And then the A, excuse me, the A is for the arm, when one arm is hanging down. And then the speech, when the speech is slurred. The T there stands for time. It says we should call for emergency. We should call 911. Now, she also mentioned causes of stroke as being when you have maybe high cholesterol, high sugar level, when someone is a smoker, when someone lives a sedentary life, when there is a heart condition, or when someone is obese, and so on and so forth. For prevention, she did mention that if we are on any drugs, we should keep using our drugs, and we should never at any time stop using those drugs without consulting our doctors. And then she also mentioned the fact that we need to maintain a lifestyle that will promote healthy living. She mentioned that we should eat right, starting with portion control, and that we should eat a lot of vegetables and fruits. He said we should avoid alcohol intake, smoking, sedentary life. Exercises should be encouraged. Let's ensure that we exercise regularly. I know that we have questions. So on that note, I'm going to open the floor. If you have a question, please signify. I will ask you to unmute and then ask your question. Let's signify by using the emoji. If you have any question. I saw a question on the chat. Someone said, what can be done to reduce cholesterol level Doctor, please, can you answer that? Please unmute.
What can be done to reduce cholesterol level?
Yes,
So
please.
first and foremost, you need to have you need to do a lipid profile. There has to be a result to that effect. You cannot just decide that you have a high cholesterol. So after you've done your lipid profile and then it comes out as elevated, it comes out as high, the doctor will prescribe some drugs for you to use and tell you to check back. So apart from using those drugs prescribed by the doctors, you also want to engage in a lot of exercises. It does not mean you have to go to the gym and be carrying weight and doing rigorous exercises. As little as a brisk walking or fast walking for about 15 to 30 minutes, 5 days in a week can do a lot. Then also your diet. You make sure you avoid foods that contain high cholesterol. Like these oils that we use, we have to use them, but it has to be in moderation. There are some types of fish that you cannot eat, like Titus fish. Titus fish is highly fatty. Like I said, concerning the food parts, a nutritionist should be able to shed more light on that. So to control your cholesterol, you have to be certified that, okay, your cholesterol is high. Your doctor is going to prescribe drugs for you. You want to engage in exercises, majorly lifestyle modifications, and then you want to watch what you eat. So that's all.
Thank you very much. So I have a Mr. Orenuga here who want to ask a question. Please unmute.
Sorry.
Mr. Orenuga, please unmute.
Good morning. And
Good morning, ma'am. Please go ahead, please.
Thank you, Dr. Ajayi, for that lecture. I had posted a question before that you spoke about support group. And I'm wondering, do we have support groups in Nigeria? That is my first question. Then my second question, I listed the food that you said we could be eating to avoid stroke. And to my mind, I don't know if the nutritionists can help us with local food that are available. Salmon is very expensive and not a Nigerian fish. Almond, whether the milk or the nut, is very expensive, and other things. What other local food are available? And I learned you said Titus fish. I thought Titus fish is one of the good fish we have in Nigeria. Please shed more light on this. Thank you.
Doctor, please go ahead. Unmute, please. Please unmute.
Okay, so let me start with the support groups. Yes, there are support groups, but they are not quite common in Nigeria. But I know that for teaching hospitals for stroke survivors, they will be able to connect them with support groups. During the rehabilitation process, where they are referred to see a speech therapist, referred to see a physiotherapist, they would be able to shed more light on how they can get support groups. They exist in Nigeria, but they are not so common. But then support groups does not, it can happen anywhere, in the sense that as long as there are people with a common goal, a common aim, a common medical condition, when they come together to share their stories and all, to encourage each other, that's already a support group. So it doesn't have to be certainly a formal, it could be a formal setting, yes, but it cannot only be a formal setting. But for the formal setting of the support group, they exist. They exist. So upon discharge, they would be referred to them. So as for the foods that you can, the local foods that you can eat, like I said, the nutritionist to be able to shed more light on that. I know some of these foods are expensive. There should be local alternatives. Yes, but the nutritionist will be able to shed more light on it. And as for the Titus fish, it's not like Titus fish is not good for the body. However, it is fatty. It contains high cholesterol. And for someone that is hypertensive, someone that is diabetic, someone that has high cholesterol, you shouldn't be found eating such. You shouldn't be found eating such. So there are other alternatives you can go for, like this I can't remember the English name now, but you can do panla. I'm sorry to use Yoruba, but you can do panla. There are some other alternatives that can be done. There are some other alternatives that can be done. Even catfish is limited. Catfish is limited because it's also fatty in some sort of way. Yeah. So Titus fish is good for the body, yes, but for someone that has high cholesterol, hypertension, diabetes, you shouldn't be found eating such. Yes.
Thank you, doctor. Can we have more questions coming on? More questions, comments? I don't think we have questions. Doctor, please, can we have your parting shots?
So my what, ma?
I said your parting shots. Maybe the final thing you want to tell them before we go.
Okay. Stroke, like I said earlier, is a medical emergency. You need to be conversant with the signs and symptoms of stroke using the FAST method. You want to seek help immediately. If you are any drug, you want to continue taking your drugs and also see your medical doctor. And you also want to monitor your parameters, like check your blood level. You want to check your blood pressure, blood sugar, your cholesterol. Just follow up on your medical illness. Yeah, that'll be all.
Thank you very much. So I see Dr. Muritala on this call. Please, can you unmute and just add your voice to this topic? Dr. Muritala is at the staff clinic at Alausa, Polani Kuka Clinic. He's not a retiree yet.
Yeah. Good morning, man. Good morning, everybody.
Good morning. Good to have you on this call.
Thank you very much, man. And Dr. Ajayi, thank you so much for that wonderful presentation. You've done a very good job telling us so much about stroke, the prevention, the treatment, and the rest. I would just like to add a couple of things. Okay, so stroke, as we know it, I'm sure everybody on this presentation would have heard about somebody who has had stroke before, or somebody who has suffered some form of stroke. So it is something that is actually very, very common in our environments. It's not just common in the Western world. And then the prevalence or the incidence of it happening is further increasing in our society as well. So due to a lot of things, including our diets, the fact that we are adopting a more Western lifestyle now, a lot of people who have sedentary lifestyle, a lot of people do not take care of their health as they should. And so, like Dr. Ajayi said, regular check of all our numbers. A few months ago, there was this campaign of Know Your Numbers, Control Your Numbers by WHO South State as well. It was a drive to basically tell people, inform people to check blood pressures regularly, check their sugar level as well regularly. And for people who are hypertensive, where the comes into it is where they need to use their drugs regularly. I see a lot of patients in the clinic where they would say, okay, I came to the clinic and they've used the drugs for a couple of days, their blood pressure is now fine, and they decide to stop their medications. Those are some of the things that that has been documented to be the major cause of things like stroke. Not just stroke, even people that come down with the complications of things like diabetes as well. So it's usually due to this. A lot of all of these things can be prevented if we do our own due diligence by using our medications, controlling our diet as well. So Dr. Ajayi mentioned a couple of things about diet as well. So especially when she mentioned the formula for our eating plate. So our plate should ordinarily be divided into four. The half of it should be fruits and vegetables. Then the other half, a quarter should be for protein and then another quarter for carbohydrates. So if you do all of these things, including adopting an active lifestyle, regular exercises. She mentioned also that we can do our exercises in our backyard. We can do it in our compounds for people who have compounds that are big enough for them to walk around in. For other people, maybe who live in estate as well, so they can just take walks around in their estates. These are some of the things that have been shown to be beneficial to actually preventing things like stroke and complications of diabetes and even hypertension itself. So please let us try as much as possible to adopt a more positive and physically active lifestyle. Thank you very much, Ron.
Thank you very much, Dr. Muritala. God bless you. Okay, so Mrs. Ogutuwashi is here. We would like her to lend her voice to this. Mrs. Ogutuwashi, please. Please unmute, ma'am. Let's hear you.
Mute. Good morning,
Yes.
everybody.
Good morning, ma'am. Good to have you.
Yeah, well, I must commend you, Mrs. Durodola, for being committed on this enlightenment program.
Thank you, ma'am.
Well done.
Thank you, ma'am.
And all your assistants, I also acknowledge their effort. Well, may God save us from the uncertainties that surround us at this time. But one thing I want to ask is that after obeying all of these rules and commandments, as it were, is it possible to still have stroke?
Yes,
Okay.
my
After fulfilling all this righteousness, is it still possible that one will have stroke? Thank you.
yes, ma, it is, ma.
Hello?
Hello, ma. I said yes, ma, it is.
It's possible that one could still have stroke.
Yes, it is. It is
That's
possible.
very unfortunate.
Yes, ma, it is. That is why the factors that we can control, we control them.
May God help us. That's all I can say.
Amen.
She mentioned earlier non-modifiable risk factor and modifiable risk factor. So it's the modifiable risk factors that we can try and control and ensure that whatever happens, we are not the cause.
Okay. Okay.
Nice
Thank,
hearing from you, ma.
thank you
So,
very much.
all right. So next, we want to hear from Mrs. Jaji. Please unmute, ma.
Okay, let me just.
Unmute, ma.
Okay. Good morning, everybody, once again. Thank you for let me thank the facilitator for the good presentation that she has made. And I want to correct one thing, because it seems, I don't know whether it was Dr. Mustafa that mentioned the fact that those of us on the platform must have had similar, experience close to stroke and all of that. I don't think that is true. Rather, those of us, I believe, that are on the platform are those who have not had the experience and would like, to be well informed on how to prevent it so that you don't have it at all. That was why I requested that maybe the facilitator, it will be useful to us, because well, managing it will be hospital, but prevention, I think, is a key thing where we can all try to avoid it, since they are on the non-modifiable factors like age and all of that. Yes, age is something that has to do with all of us, but it's prevention of diseases or factors, that can inflame the body or something. That was what I thought the facilitator, would dwell more on. And more importantly, our diet and the portions. I want to thank Dr. Mustafa, for shedding more light on it. I think all in all, I think we have been informed. I want to thank the facilitator once again, and Dr. Mustafa, and of course the post-service department that is doing a great job in looking after us after our service. Thank you.
Thank you very much, man. It's nice hearing your voice again. So maybe in another webinar we can come up with a topic on maybe nutrition for the elderly, so that we can at least have some maybe local foods, like somebody mentioned earlier, that we can be eating to ensure that we maintain a healthy life. So on that note, I want to now invite someone to appreciate the facilitator before we draw the curtain on this program for today. I want someone to signify. Okay, Mrs. Okewo is here. Mrs. Okewo, please unmute, ma, and appreciate the facilitator on our behalf. Okay, can we have Mrs. Cole? Please appreciate the facilitator. Mrs. Cole, please. All right, okay, Mr. Ajibade is here. Mr. Ajibade, please, can you appreciate the facilitator on our behalf? Please unmute, sir. Is it for my end? Please unmute, sir.
Okay,
All right.
I've done that.
Thank you, sir. Okay.
Well, the facilitator, you have handled a very critical topic that is ravaging not only Africans, but the world over. And I think you have done justice to just that. You have told us causes and you have told us prevention. So we want to, on behalf of all my ogas and colleagues in the House, appreciate you for patiently going through the topics and at least being very concise and very clear in a very simple manner. You have communicated to us, how we can help ourselves to avoid being a stroke victim. So I want to appreciate you on behalf of others and say a very big thank you to you. God will bless you, continue to increase you in wisdom, knowledge, and understanding. God will elevate you. Thank you for impacting that knowledge into us. And I pray none of us going through what with the season we are will ever witness any ailment of stroke or any other ailments. Thank you very much. Have a blessed day, and God will continue to bless and guide you. Thank you.
Thank you very much, sir. So on that note, I want to, on behalf of the head of service and the permanent secretary public service office, they are both unavoidably absent this morning, attending to some important state matters. I want to appreciate each and every one of us for joining us on this call once again this morning. It is because you're always coming back. That is why we have been very consistent in ensuring that we bring different topics around our health, finances, and business. So once again, I say thank you. We are live on YouTube, and I will share once again the YouTube link with us so that we can go back and once again listen to this particular topic and all other topics that we have treated in the past to refresh our memory and to ensure that we internalize and make use of everything that we are learning on this platform. So on that note, we have come to the end of this program. I'm going to change the setting as we usually do so that we can exchange pleasantries. Okay, so I've changed the setting. We can all unmute now. We can put on our videos. I see that majority of us, our videos are not on. Let's see one another's faces. Okay, I'm seeing Mrs. Simpson already. Mrs. Simpson, how are you? I like the smile.
Good morning. Good morning. Thank you very much. Thank you so much for this program.
Oh, I wanted us to sing birthday song.
Good morning.
Mrs.
Thank you very much.
Okay. Thank you.
Oh, yeah.
Mo kí gbogbo ilé ọ̀gá mi, mo kí yín o. Good morning, sir. Mr. Ajibade. Ẹ káàárọ̀ sà o.
Headmaster, good morning, sir.
Ọ̀rọ̀ tí wọ́n náà sí dáadáa o, tiẹ̀ náà dé o.
Àmì sà, ẹ ṣé sà.
Lágbára Ọlọ́run nígbàgbé ẹ o.
Àmì sà.
Amen.
Àmì sà. Ó dà kí madam náà join wa. Mo kí yín o, madam. Mr. Ajibade.
Ẹ kú iṣẹ́ mà, ẹ kú iṣẹ́ mà. Ẹ ṣé, well done, mo dúpẹ́ o.
Well done.
Sade kan yìí, I'm greeting mi ò kàn rójú ni o. Mi ò rójú.
Ìrọ̀dà lábàwọ̀ ni o, thank you for
everything. Ẹ gbójú síta, ẹja rójú yín o.
Àdúgbò máa ń àwọn everybody kàn hide láàárọ̀ yìí ni o.
Ẹja rójú yín o.
Adísì lọ́wọ́.
Ọ̀gá ẹ̀yin kan tẹ gbé fídíò yìí sí ẹ àrójú yín náà.
Bí lè ṣe ṣe.
Mo yẹ ṣe rójú yín sì ni. Mo ṣe rí sì ni.
Àmọ́ kí ni slide ṣì wà lójú bọ́ọ̀dù kò jẹ́ kí ó gbẹ bá
wọn. Kódà yẹn kó àwọn èèyàn wà ní abẹ́ dúvè ni o, àwọn èèyàn ń sùn ní orí bẹ́ẹ̀dì ẹ̀kú ká bẹ́ẹ̀.
Àwẹ̀ ń gbò wọ́n.
Okay.
Thank God. Thank God.
Thank God indeed.
Anirogun àìsàn, anirogun stroke o.
Àmì o. Àmì o. So let me end the meeting so that we can go on with our prayers. Torí àwẹ̀ la wà ká lè lọ máa gbàdúrà. So until the next 2 weeks, we are going to have another topic, maybe on business or finance. So see you then. Bye.
Thank you very much. Bye.
Thank you very much. Bye-bye.
God bless you.
Amen.